Good afternoon, ma'am. My name is Tricia, your physical therapist for today. So, for verification purposes, may I know your name and age?
Baby Lee, 36.
Okay. So, for safety purposes, ma'am, we need to wear the mask the whole duration of the therapy, as well as we need to sanitize for safety purposes. Okay. So, our patient is a 36-year-old who has a second-degree burn in the dorsal aspect of the right hand, acute stage. So, what brought you here today, ma'am? What's your goal? What's our goal for today?
Gusto ko mabalik ang iyang pag-ano ko sa atong hand.
So, the patient's functional goal is to be able to regain full function, full range of motion in his hand, and as well as due to the injury, the patient is a burn patient, so we'll treat possible. We need to do following exercises to prevent any contractures. Okay. Okay. So before we proceed with the therapy, ma'am, I need to check your vital signs to ensure that you are fit for the exercises prepared for you. Okay, ma'am. Okay, so for vital signs, we're gonna use for blood pressure. We're gonna use a sphygmomanometer. Check for your blood pressure. Okay. I would like you to relax, mom. Your blood pressure is normal. It's 110/70. And now we're gonna check for your respiratory rate and pulse rate. Okay. Good. Then as well as for the respiratory rate and pulse rate are within normal limits, and then temperature is also normal. So now we're gonna start with the plan of care. So the plan of care I prepared for the patient is first we're gonna start with a passive range of motion exercise for her wrist and hand for it to slowly adjust to motion. And then next we're gonna proceed to an assisted active exercises, active range of motion exercises. And then once the patient is comfortable, we're gonna proceed with active range of motion exercises. So these are the exercises we're going to be performing to the patient, and all of these are going to be 10 times twice a day. So the first exercise is we're going to place the patient's hand elevated heart level, and then we're going to do a wrist extension. So I'm going to hold the distal portion of the arm and then extend, firm and feel. And then next is a extension, flexion. And then next is radial deviation. And then ulnar deviation. Next is for finger flexion. Finger flexion. So we're gonna start with the metacarpal joint. Finger flexion. And then proximal interphalangeal joint, as well flexion, and then distal interphalangeal joint flexion. And then same procedure but extension. So we'll start from the metacarpal phalangeal joint, and then proximal phalangeal joint extension, and then the distal phalangeal joint. Now we're gonna do a thumb extension, and then thumb flexion, and then thumb abduction, and then thumb adduction. And next is we're gonna Next is we will, after this, when the patient's comfortable, we're gonna proceed to the assisted assisted active range of motion exercise, and then to the active range of motion exercise. Okay, ma'am? So we're gonna do this on 10 times twice, 2 sets, um, for 10 sessions. Okay, so now I need to check your vital signs again to ensure that everything's normal. Blood pressure is normal. Pulse rate is normal. Respiratory rate is normal, and temperature is normal. So okay, so that's it for today, ma'am. Thank you. See you in our next session. Okay,
Thank you to me.
then for aftercare, clean the area, sanitize the area used, and then okay, that's it. Thank you.
Can I go now, miss?
Yes.